Good afternoon. Welcome to the first meeting of the Assembly Committee on Health and Human Services of the 82nd Legislative Session. Madam Secretary, will you please call the roll? I'm sorry, Mr. Secretary, will you please call the roll?
Assemblywoman Gonzalez.
Here.
Assemblywoman Gorlow.
Here.
Assemblyman Gray.
Here.
Assemblyman Hafen.
Here.
Assemblyman Hibbets. Assemblyman Koenig. Assemblywoman Newby. Assemblyman Wynn.
Here.
Assemblyman Ortlicker.
Here.
Assemblywoman Taylor. Assemblywoman Thomas. Chair Peters.
And I am here. Everyone is present. Thank you all for being here today. So on today's agenda, we will have staff and committee introductions, adoption of committee policies, and presentations from staff in the Department of Health and Human Services. And we have four BDRs, committee BDRs to introduce as well. I'm going to go ahead and start with a couple of comments and some housekeeping, and then we'll move into introductions. First of all, I'd just like to say that we're grateful to be back in the committee chambers with all of you. It's been a long 3 years, and I know we're all looking forward to finding a groove in this new normal space. Please know that we are working to ensure that we are accommodating access needs, but if there's something specific that you need or think will make this committee more accommodating, please feel free to share that information with me or staff. We have several new members and are happy to have you all with us this year. I've worked with staff to identify issue areas of relevance to this committee that are worth digging into a bit more. So we will be starting the session off with several presentations to the committee. We recognize that this is not a comprehensive list of issue areas that will be heard in this committee, but wanted to make sure we introduced you all to major topic areas of it, as well as the staff who support those areas in Nevada. That being said, we have wonderful staff I will introduce in a minute who can help answer questions and connect you with the right person to answer your questions on any topic area under the purview of this committee. As I'm sure you've heard in other committees, I do expect folks to act respectfully in this committee. We will not tolerate disrespect. We are all here because our constituents elected us to do the job of this body, not to squabble over political rhetoric. Lastly, I want to mention that topics heard in this committee are often personal and can elicit strong emotions. I have been known to cry several times in committee over the years. We honor these reactions. And please prioritize taking care of yourselves, whether it's to excuse yourself from the space if you're being triggered or to take a deep breath before you respond or ask a question. A couple housekeeping announcements. First, I'd like to remind everyone to please silence your electronic devices. Just check mine to make sure it's done, including your laptops and cell phones. Members of the public may provide testimony in a variety of ways, all of which are listed on the agenda. Today, we will have public comment towards the end of the meeting. You may also submit public comment in writing, whether in addition to testifying or in lieu thereof. Written public comment may be submitted before, during, or up to 24 hours after the meeting adjournment. If you wish to testify in person, please sign in at the table by the doors and leave a business card. This helps us keep track of who you are as you're speaking and make notes that go into the record. Anyway, anyone who would like to receive electronic notifications and access to the committee's meeting materials can do so by signing up on the legislature's bill tracking website, Nellis. To ensure an orderly flow of discussion, all comments, questions, and responses must go through me. Also, committee members, please be recognized by me before you speak. When testifying in person, please turn on the microphones to speak and off to listen, because we will get some feedback between our room and Las Vegas if we don't entertain that. And with that, we'll move on to introductions. First of all, I'd like to start with our committee members. Members, if you'd like to introduce yourselves, please include the district you represent and your interest in health and human services, as well as your goals for the committee during this session. I'm going to go ahead and start with Vice Chair Ortlicker.
Thank you, Chair. It's great to be back. David Ortlicker, Assembly District 20 on the southeast side of Las Vegas. If you're standing with your back to UNLV campus facing east, that's my district, and This is my second term on this committee. My background's in medicine and law. I teach health law at UNLV, so in my professional life, I spent a lot of time thinking how we can improve our healthcare system, and that's what I hope we can do, to do more in the way of prevention and improve access to healthcare. And did I cover everything? Anything else? I think that's it. So thank you. I'm delighted to be here and working with you all.
Thank you so much for being here. Appreciate having you as vice chair. Assemblyman Hafen. I have an order. It's not in order as we said.
I just thought you were just going down the row, so you caught me off guard. Gregory Hafen II, Assembly District 36. I actually think I see a couple constituents in the room today, so welcome. We've this is my third session on Health and Human Services, and over the last 3 years, we've seen our medical community really be overburdened, and so I'm really looking forward to hearing policies that are going to help bring more medical professionals to our community, and also to be able to help our citizens of this state with their mental health and their medical needs. I think this is probably going to be one of the most important committees this session, so I appreciate the opportunity to serve here, Madam Chair.
Thank you. Assemblywoman Gorlow.
Thank you, Madam Chair. I'm Assemblywoman Michelle Gorlow. I represent Assembly District 35, which is in the southwest of Las Vegas. And prior to working on the legislature, I was an advocate for women and children's healthcare issues. So I'm very passionate about those issues especially, and look forward to being on this committee for my third session.
Welcome back. Assemblywoman Gorlow is our most senior member, and as well as I think Assemblyman Hafen. So welcome back. Thank you so much for being here. Assemblywoman Thomas.
Thank you, Madam Chair. I'm Assemblywoman Claire Thomas, representing Assembly District 17 in beautiful North Las Vegas. And some of the boundaries that you may be familiar with is the VA hospital, which is in District 17. So is Nellis Air Force Base, represent about 5-mile radius of that. Just so, I don't know how many people in here recall the pig farm. You know, if you are familiar with the pig farm, that's 17. So I'm just glad to be on this committee again. This will be my second term here. And I look forward to just working for the people of the state of Nevada. And thank you, Madam Chair.
Nevada is so small. I think my cousin used to work at that pig farm. Assemblywoman Gonzalez, welcome to the committee.
Thank you so much, Madam Chair. My name is Assemblywoman Gonzalez, and I represent Assembly District 16 in the heart of the Las Vegas beautiful community. And this is my second session, but my first time on Health and Human Services, and I'm very excited for all the things that we will do and look forward to working together. Thank you.
Thank you. Assemblywoman Newby.
Thank you, Madam Chairwoman. My name is Sabra Newby, and I represent District 10, which is near downtown Las Vegas and then stretches a little bit west from there. This is my first time in the legislature, and I'm truly a newbie. And that joke never gets old. And on this committee, I am particularly interested in mental health services, and particularly mental health services for children. Thank you.
Welcome to the committee. Assemblyman Nguyen.
Thank you, Madam Chair. It's great to be here. Thank you for having me. My name is Yui Nguyen. I proudly represent District number 8 in the southwest of Las Vegas, one of the most diverse districts in Nevada. Just want to U-turn back to the other topic, which is my first name. I did that in my other two committee. I want to make sure I do it here as well. My first name, I know we go by assemblyman or assemblywoman in this building, but in case you ever have to use my first name, just think of me when you do a U-turn, okay? The D is silent, Yui. Make a U-turn, make a Yui, right? So Yui win or you win, that works too. But just want to make sure that I give a shout out to my attaché for reminding the entire building and perhaps all the state agency how to get my first name correctly. So thank you, Travis. My interest is also as a parent, as a community advocate, as a small business owner. Healthcare is the foundation of everything. And in terms of background, I used to run community clinics and private clinics. So I definitely have a vested interest in seeing how we can reduce the barrier to care, and as well as enhancing the language access. And that's something that I'm very passionate about in terms of the work in the Asian Pacific Islander community, which is one of the fastest growing community in our state. So thank you for having me, and thank you, Madam Chair.
Thank you and welcome. Assemblywoman Taylor.
Thank you, Madam Chair. My name is Angie Taylor, and I proudly represent District 27 in Washoe County, the university area, West University, North Reno, and then up to Sun Valley State area. And this is my first year in the Ledge, so I'm very, very excited. It's day 3, and I'm still excited. So hopefully we can say that on day 113 and such. But very excited to be here, very excited to be on the committee, and looking forward to the work with my colleagues to keep people in Nevada, give them the care that they need, and keep them safe. Thank you.
Thank you and welcome. Assemblyman Gray.
Can you hear me? There we go. Thank you, Madam Chair. Ken Gray, Assembly District 39, which is the Central Lyon County corridor, and all of Douglas County. About 26 years in healthcare, both in the military and the public sector. Looking forward to representing the rural's needs. As you know, I mean, as we all know, we've got shortages all over the place, but it's more acutely felt in the rurals. Without doctors, and not even just doctors. I mean, just places to go. Period. I mean, we have a real shortage of practitioners of all varieties. But just looking to see what we can do to address those needs. Thank you.
Thank you. Assemblyman Hibbets.
Thank you, Madam Chair. My name is Brian Hibbets. I represent Assembly District 13, which is in the northwest portion of the Las Vegas Valley. This is my freshman year, so I have not been on this committee before. I am looking forward to hearing testimony so that I can learn what it is that I can do to help our citizens. Thank you.
Thank you and welcome to the committee. Assemblyman Koenig.
Assemblyman Koenig, District 38, which part of Lyon County, all of Churchill County, all of Mineral County, all of Esmeralda County, and a little bit of Tonopah. So I have a lot of empty space. I'm a practicing optometrist, so my career is in healthcare. I want to kind of mimic what other people have said, but it's important to me that we get the providers needed to the rurals, especially mental health and specialists. There's a huge lack of specialists. I don't want to go long at all, but I have patients from out in the middle of nowhere that I'm pretty much holding their hand, watching them go blind because they are not able to get to one of the big city populations where the specialists are at, and there's no way that they can get there, and it's pretty heartbreaking. So we definitely need to see what we can do to help get some of the specialists out in the rurals and help out my rural constituents.
Thank you so much and welcome to the committee. As you can see, we have quite a variety of backgrounds and expertise in this room. I'm grateful for all of you being here and look forward to the conversation we have in this committee room. I'm Sarah Peters. I represent Assembly District 24, and I've been honored and proud to represent this district for 3 sessions. This was my 3rd session. I vice-chaired Health and Human Services last session during one of the most trying times in this building with COVID, and I'm grateful to be back in a more normal capacity. I also had the opportunity and honor of chairing the Joint Interim Committee for Health and Human Services, during which we explored a variety of issue areas, including behavioral health care, children's wellness issues, public health issues, and insurance coverage issues, just to name a few. We have some BDRs today to introduce that came out of that committee. I'm looking forward to working on those bills with you all. My priorities in this committee kind of align with what we looked at during the interim committee. Behavioral health care is really a passion area of mine, and I think many people know this. It's not a surprise that that's going to be a topic area that we really dive into here. I'm also very passionate about access and transparency, increasing access and increasing transparency so that patients are the center focus of all care in the state of Nevada. I also agree with my colleague that reducing barriers is a part of that transparency piece, ensuring that people know how to get access to the care that they need, and have the ability to access it, whether they're in our rural communities or our urban districts, that we all have an equitable access to health care that we need and our families need. And I think top of mind for me is always harm reduction. What can we do to reduce the harm that exists in our system? It's our healthcare system. Inherently, you'd think that harm is being reduced. That's not always the case, and sometimes the system has been manipulated or broken in ways that increase harm. So as we process bills, as we process issues, as I look at what we're doing in the committee, that is always top focus for me. Reducing the harm to the public and patients, as well as to the industry that supports what we are able to provide to our constituents. As I said earlier in the committee, I do expect that our members and those who join us and the public and those who present in this committee to act with respect to each other. We don't always have to agree, and we certainly won't always agree. But it's important that we give each other the deference to say our piece, to share our stories, to share our opinions, but also to respect that we all deserve that same thing in return. I won't tolerate name calling. I won't tolerate abuse of decorum in this room. You will be asked to leave. So know that coming in. I have not had the pleasure of having to remove somebody from committee before, so I hope that never comes to be, but I just want to put that out there as the standard for our committee actions. Enough about me. I'd like to introduce our staff, and I gave staff the option of introducing themselves or having me introduce them, and I'm going to do most of our introductions. If I get anything incorrect, please flag me down and correct, but I'm going to go ahead and start with Ms. Ishmael. As an Arab Israeli, she was born in the north of Israel. She lived in Jerusalem for 25 years, where she worked intensively with the government in her capacity as a health policy researcher and later as a program director at the Rothschild Foundation. Her main expertise is in health policy, health inequities, workforce development, and local governance. Before moving to Reno, Nevada, she lived in Boston for 3 years, where she acquired her master's in public administration from the Harvard Kennedy School of Government. She's grateful for the opportunity to utilize her skills, knowledge, and expertise in support of the legislature's mission and the common good of the people of Nevada, and we are so grateful that you are here. Please welcome back Terry Horgan, our committee secretary, who unfortunately cannot attend today. She lived in Carson City since 1975 and is a retired bookkeeper. She has worked as a committee secretary for many legislative sessions, primarily in the Health and Human Services Committee. Terry says she loves her job. Colin McGinnis is my personal attaché. He's born and raised in Reno and graduated from UNR with a degree in political science. When he's not at work, he is passionate about photography, playing the cello, and gardening. Side note, I've known Colin since he was about 12 years old, and I'm glad that he's in the building. I remember one of the first conversations we ever had was about politics. That was over a decade and a half ago, maybe. Also over here with Colin is Rachel, who is my intern, and she is fabulous at UNR, getting her master's degree in public health. So when you come by my office, you'll see these two, and they'll be helping out with the committee. Please also welcome Ashley Torres, who will serve as the committee assistant for Health and Human Services, Education, and Judiciary. Ashley was born in Huntington Park, California, and moved to Carson City in August 2014. She and her family enjoy all the outdoor activities that Northern Nevada has to offer, like hiking, kayaking, and sightseeing. This will be her first legislative session, and she's very excited to be a part of such important work. Thank you for being here. Next, Eric Robbins, one of our committee council, will introduce himself.
Yes, I am Eric Robbins from LCB Legal. This will be my sixth legislative session, and I have staffed Senate Health and Human Services since 2015, but this will be my first time assisting with the Assembly. I look forward to the experience.
Eric was our legal staff during the interim, so we're grateful to have him here as well. Our second committee counsel, David Naus, did I say that right?
Yes.
Great. Will introduce himself as well.
Hello, my name is David Noss. This is my second legislative session with the Nevada Legislature and my first as counsel for Health and Human Services. During the interim, I was junior counsel for the Nevada Youth Legislature. So I'm excited to be here, helping out where needed and helping out Eric with whatever that needs to get done.
Thank you. We're grateful to have you here. And finally, Patrick Ashton, our committee policy analyst, will introduce himself.
Thank you, Chair Peters. Hello, my name is Patrick Ashton. I'm a policy analyst from the Research Division of the Legislative Council Bureau. This is my third session with the legislature, and during past sessions and interims, I staffed a lot of health and human services and commerce and labor related committees. Some background about myself. I have 2 master's degrees from UNR, one in social work, the other one in political science. I'm also a licensed social worker, working before at the Aging and Disability Services Division and at the University Center for Autism and Neurodevelopment at UNR. And I'm originally from Munich in Bavaria, Germany, but since 2009 I call Nevada my home. So I'm really honored to serve as your committee policy analyst and looking forward to an interesting session. Thank you.
Patrick is also, Mr. Ashton is also trilingual. And we really just have the most fantastic staff in this building, and I'm so grateful for all of the knowledge that you bring in and all your expertise as well to help make these committees go smoothly and to help us figure out what it is the heck we're doing in this area. Thank you all for being here. We're going to go ahead and get started with the adoption of standing committee policy. This is our first order of business. And these policies are on the legislative website. I grabbed the wrong one. I don't have my papers in front of me. Because we're trying to go less paper, I forgot to mention this as well. Although we're trying to be accommodating for people's access needs, we are limiting the amount of paper copies that are required to be brought in by presenters in the committee. This is just to try and reduce our carbon footprint in this room. If you do need one, please let us know and we can make sure we hold one for you. Today, we also saw that the internet happened to go out, so I know that makes it difficult to have access to those documents, but we will try and be as accommodating as we can be while also trying to meet that goal of less paper in our recycling. So these committee policies are posted on the committee's website. The work of committee is governed by the Assembly standing rules and the joint standing rules that we adopted on Monday in the full Assembly. The proposed committee policies serve to complement these rules by adding more detail for our specific committee. Members of the committee, are there any questions regarding the committee policy? I will entertain a motion to adopt the committee policies for the Assembly Committee on Health and Human Services.
Second.
Oh, thank you. I have a motion made by Assemblywoman Newby and a second by Assemblyman Nguyen. Are there any comments or discussion on the motion before we vote? All those in favor, please signify by saying aye.
Aye.
Thank you. Any opposed? Thank you. The motion carries with all those present. Our committee policy analyst, Patrick Ashton, will present the committee policy brief. Mr. Ashton, please begin whenever you are ready.
Thank you, Chair Peters. For the record, Patrick Ashton, policy analyst with the Legislative Council Bureau. As nonpartisan legislative staff, I can neither advocate nor oppose any of the proposals that come before you during session. I'm here to assist the chair and members of the committee with any questions concerning policies that may arise. My only agenda is to be objective and provide you with unbiased information. I'm available to assist the committee and its members on any issues related to health and human services. In addition, the research division is available to provide information and assistance on a confidential basis to individual members of the legislature on any topic. Please feel free to reach out to me or my colleagues at any time. Now going to the committee brief. You've all been provided an electronic copy of the committee brief. It's also available on Nellis. The brief provides background information on the work of the committee and policy issues that you may consider this session. I'd like to take just a few minutes to cover some highlights. On page 1 of the committee brief, you will find an overview of the committee staff and committee jurisdiction. On page 2, there's an overview of the committee activity last session. During the 2021 legislative session, this committee considered a total of 44 Assembly bills and 26 Senate bills and resolutions, which is 70 measures in total. 54 of these, or almost three-quarters, were voted out of the committee. The legislature approved 51 measures and 1 bill was vetoed by the governor. Overall, the committee considered less bills than usual last session, most likely due to the special session format during the COVID-19 pandemic. Regarding the vetoed bill, Governor Sisolak at that time vetoed SB 391 after the legislature adjourned sine die. On page 2, you can find a short summary of this bill. Now, turning in your committee brief to page 2 through 5. So for the next months, you can expect hearings about many health and human services issues, either in this committee, Commerce and Labor, Ways and Means, or on the floor. For example, you may consider measures related to access to health care, behavioral health, homelessness, public health, and prescription drug costs, just to name a few. The committee brief provides background information on these highlights. You will also hear detailed presentations from subject matter experts on public health, behavioral health, and Medicaid and welfare in the next couple of weeks. Next, on pages 6 and 7 of the committee brief, you will find an overview of relevant audits, reports, and studies, such as interim committee bulletins and reports that summarize the work of committees and studies during the past interim, as well as pertinent legislative audits from the LCB Audit Division. The committee brief contains hyperlinks to the audits, reports, and bulletins if you wish to dig deeper in on certain issues. Chair Peters, this concludes my presentation, and I'd welcome any questions.
Does the committee have any questions for Mr. Ashton? Thank you so much, Pat and Mr. Ashton. I appreciate that overview, that will be on the legislative website. If you would like a copy of it, you can have your attachés print that for you, or you can just reference our committee website. I'm going to go ahead and start us real quickly just so we can keep the BDR process going with a BDR introduction. These are committee BDRs. I want to be clear that the introduction of these BDRs just allows them to go to the floor for them to be introduced and referred to our committee so that we can have formal hearings on them. Voting yes on introducing these committee bills does not preclude you from opposing these bills when they come to committee for hearing, and it does not demand that you support these bills as they move through the process. This is just a part of the process of these interim committee bills. BDRs, they're not bills yet. We have 4 BDRs today. This is my first time doing this, so bear with me for a minute. We have BDR 38326, which requires certain facilities to be licensed as childcare institutions. We have BDR 40327, which revises provisions related to fetal alcohol spectrum disorders. And we have BDR 38332, which provides Medicaid coverage for certain types of behavioral health integration services. And lastly, we have BDR 40324, which revises provisions relating to homelessness. Do I have a motion to introduce these 4 BDRs? Thank you. I have a motion from Assemblyman Ornlicker and a second from Assemblywoman Gorlow. Thank you so much. Are there any comments or discussion on the motion before we vote? All in favor, please signify by saying aye. Aye. Any opposed, nay? The motion passes with all those in attendance. Thank you so much. We'll have those sent down and processed. All right, next we're going to get on to our overview from the Department of Health and Human Services. I'd like to invite Director Whitley and staff to come up for this presentation. This presentation is uploaded onto our committee website if you'd like to pull it up and view it there, or we will have it up on the prompters as it's uploaded. Welcome to the committee. Thank you so much for being here. Very excited to hear how your department is doing and what you will have for presentation today. Please proceed when you are ready.
Thank you, Madam Chair. For the record, my name is Richard Whitley, and I serve as the Director for the Department of Health and Human Services. And with me today on my right is Marla McDade Williams. She serves as the Deputy Director at DHHS. And then on my left is Kyra Morgan, and she serves as the state's biostatistician. And we'll talk a little bit later into our overview on just the capacity that we have enhanced our data analytics with, and the role it plays in our funding and policy making related to health and human services. So I appreciate the invitation to present, and really I think you're going to hear as chair, as you mentioned, in detail from some of our divisions that'll take a deeper dive into certain aspects or populations related to health. But I want to give an overview of our agency so that if in the course of your work you also, or your legislation consideration, you have requests for data or information, or sometimes even like why do we provide an aspect of a program, because often it's a federal program and it's the only funding we receive and it is pretty specific. So there are a lot of nuances to some of the programs that we provide, and on the surface they may sound like comprehensive, but they're not always that way. So I guess my intent and hope today is that if you have interest in any of our programs, you can reach out. I'm accessible and helpful in my intention. So if there are, or if you have constituent concerns with navigating the complexities of healthcare, I also extend myself in that way to figure out how to help Nevadans who are seeking services. I would say that as a broad overview, our biennial budget in DHHS is over $16 billion. We are nearing 7,000 employees, and those employees range from direct service providers to regulators to fiscal management. But we are the largest state agency. The primary driver for cost in DHHS is Medicaid. Medicaid is the largest payer of health care in our state. Our agency, as I said, is really involved in all aspects of healthcare, from primary prevention to intervention to quality services. Go to the next slide, I think. We do this across the lifespan, and we do it with subpopulations that sometimes are either more burdened with disease or risk factors. And we do our work in traditional healthcare settings as well as those settings that influence health or are the determinants of health. The department is organized into 5 divisions, and that's where you'll hear as the committee proceeds during the session some focused topics. But our divisions are, in my head, I keep them organized as eligibility, which is the Division of Welfare and Supportive Services. So that function is consolidated. If you have any constituent who actually ever applies for SNAP or what in the past was called food stamps or WIC, or Medicaid or temporary assistance for needy families or any of the energy assistant programs, we have a consolidated application process. And so the consumer is prompted that if they have additional needs, so they don't have to basically wait in multiple lines to get access for services. It is a means-based process, and so verification is done, but it's not done for each categorical program. So that efficiency, and if during the pandemic, as a sub-story to the DEETR delays, I'm quite proud that our agency, our welfare division, was able to help out with their workforce to help speed up the processing in DEETR. And some of that, I think, has to do with the efficiencies that we have been able to produce with eligibility. The other division is Medicaid, of course, so the Division of Healthcare Finance and Policy, and it is the state's largest payer of healthcare. Transformational over time, which is, I think, helpful to look at. Governor Sandoval actually opted in to expand Medicaid, and currently we're at about 90% of our Nevadans are insured either through commercial insurance or Medicaid. I would say, sadly, in that that children represent about 56%. About 56% of the births in Nevada are on Medicaid, which means that those children are living near or in poverty, and so a lot of work to do in that space as we are a payer, but being a payer isn't enough. And I think some of you mentioned that in your introductions of areas of interest in such topic areas as children's behavioral health. You can have a payer source, but if you don't have providers, it doesn't matter. You can't access health care. Or if it's remote and you can't get to it, it doesn't matter if you have a payer source. And so none of these service areas work in isolation to solve problems. We have to work them together. Somebody could have health care but need food. And so, the integration of our programs, I think, is something that our agency prides itself on. So eligibility and payer. And then we have 3 divisions that are more population focused or service focused. Division of Child and Family Services. And they really run the gamut from child welfare, primarily in the rural areas. That's their role as a direct intervention point in collaboration or through contract with the rural counties to serve in that role for child welfare. Clark County and Washoe County implement their own child welfare systems. On the juvenile justice side, DCFS oversees the juvenile. They have juvenile facilities as well as juvenile parole. The counties do probation and the state does parole. It's a complicated system, but requires working with local counties and to make a comprehensive system. And then finally with DCFS, we also have children's behavioral health. And I think this is important to understand in our agency when we look at the 3 agencies that provide services. The complication in Nevada, being a small state, is we fund services, we regulate services, and we fill in as a safety net to provide direct services. You know, with the pandemic and workforce shortages, we've had challenges in all of those areas. We had made some strides, I think, and just really the challenges to hire staff has put it at a deficit. The other division then, Division of Public and Behavioral Health, has a dual role of the state's public health system, which is a system that likely you don't hear much about until you need it, you know, protecting the public's health. There isn't a line of people waiting for that service. It usually comes in the form of primary prevention, you know, clean air, clean water, the food you eat is safe, but probably, you know, the foundational program in that is our children's immunization program, that ensuring that children are vaccinated. We manage in that division the Vaccine for Children program, which is a safety net program to ensure that all children in the state have access to vaccine. Public and Behavioral Health also oversees some direct services. The big area that was impacted by the pandemic is in the area of forensic mental health. The state has a statutory responsibility to do assessment and restoration to competency. During the pandemic, the need for those services was not great, and in fact had somewhat slowed down. And then clearly we're bottlenecked, and we're not meeting all the needs. And if you're on a budget committee, you'll see a request in our budget to expand our forensic hospital in partnership with the city of Las Vegas, who had an empty jail and we're converting into a forensic hospital to help meet that backlog of inmates waiting for assessment and restoration to competency. But we also provide, as a safety net in public and behavioral health, civil hospitals. Nevada's one of just a handful of states who really held on to direct service delivery over the decades, when most states moved from state-operated direct services in mental health to county-delivered mental health services to now being community-based mental health services. The expansion of Medicaid really changed everything, because the individuals having a payer source and choice, which is a good thing, had the ability to actually get services in places other than state agencies. We still operate civil hospitals and do serve as that safety net to the community. There are delays sometimes in the rural areas when the critical access hospitals have a need for transfer. You'll hear from those acute hospitals that the emergency rooms sometimes have a backlog of people with serious mental illness. But also in the Affordable Care Act, there is parity with behavioral health. So behavioral health is a health condition, and one of the complexities that the Division of Public and Behavioral Health does is they regulate health facilities such as hospitals. And in order to bill Medicare and Medicaid, you have to be licensed and certified. And with the certification of hospitals comes, it's actually the only health facility type that federally has a requirement for appropriate discharge, which is surprising, but it is to prevent like the dumping of patients, and emergency rooms get bottlenecked because they have to appropriately either transfer the client or discharge them, and if there's nowhere to go, they stay in their emergency room. So that's a problem that we're solving. During last session, we were approved for crisis stabilization centers, and those are much like an urgent care for behavioral health, but connected to a hospital, but they don't have to be on the campus, and we're currently working on standing those up. Additionally, we, in public and behavioral health, we were one of 8 states to receive a federal award to stand up certified community behavioral health clinics. And those are clinics that, if you're familiar with federally qualified health centers, like many of those serve primary care in the rural areas, but also in urban Reno and Las Vegas. But those are federally endorsed clinics that can't refuse service to anyone based on their ability to pay. And this certified community behavioral health clinic model is much like that. It pays an enhanced rate to the provider, so the providers of those service, unlike a lot of providers who have to balance out the support of their services by not just taking Medicaid clients, because we don't reimburse that well. We're the lowest payer, lower than Medicare. That these certified behavioral health clinics and the federally qualified health centers do an enhanced payment and essentially make the providers whole. And so in that, they're federally required not to deny anyone service. You'll see in our budget this session that we're standing up more certified behavioral health clinics. Las Vegas definitely needs additional. They have 1 currently. We have a few throughout the rural areas. In Elko, Vitality Center really has been started as a substance abuse treatment facility, took advantage of the opportunity to grow off that model and expand to a certified community behavioral health clinic, and then they spread out to other parts of the state, including Carson City and Dayton and Reno. So it's provided an opportunity for some service providers to really grow and develop, and I'm very excited that the governor put in the budget to expand those and make those more available. Those services must provide a network of care, so not just the clinical services, but housing support, transportation, addressing food security. So they have to demonstrate an entire network of care, and they must serve both children and adults. So as you can tell, the Division of Public and Behavioral Health has a lot on its plate, larger than some state agencies, actually. But that role of being a funder, a regulator, and then a direct service provider has been a challenge in our agencies. The final agency that I'd go over is Aging and Disability Services. And just as the title suggests, the focus is on the aging population. Similar to child welfare, we do this in collaboration with the counties. Probably a little bit fragmented, and there's probably areas that we could improve in providing those senior services. We definitely saw that during the pandemic with, the goal is to help individuals live as independently as possible in their home environment. And with the workforce shortages, some of the personal care work that was done in homes was made harder by the pandemic, and even the recruitment of staff in those areas. And so that you'll see in our budget an enhancement in the rate that we pay those folks that go into the home and help people to live independently. And then the disability services, the same. We have facilities in Las Vegas. We try to work with if the individual can live in a natural environment with their parents, we try to support that. If they need to live in a home in the community, we regulate and fund those. But again, to help people to live at their highest level as independently as possible is the goal. Last session, we also added, we tried to consolidate. We had several programs that categorically went towards informing the public or educating the public. It's probably the area that I'm that I feel like I have the most work to do in it. We have 211, which is a referral system but we also have ombudsmen who can follow up if any adult is being abused or neglected. But there's a space in there in the area of like health literacy, helping people to understand. If you navigate our website, you can see, like if you went on in DPBH and looked at healthcare quality and compliance, that's the agency that actually licenses and certifies health facilities. Like if you had a loved one or a constituent who was trying to make a decision about where to place somebody, you really the site reads fairly bureaucratic. I think that we could do more in this space to help the consumers understand when making decisions, like who could best serve my loved one, or who could best serve me if I'm looking for a facility. And so we've just started to work those programs together a little bit more, and in a way that actually is more transparent and meaningful to consumers. Sadly, in government work, and I would just say that, I'm a lifelong public servant, and I believe in the services to the public. But it's like the governor has challenged us all to look at regulations and how those might be a burden. We don't often do that pause and like we're adding a new regulation, and then sometimes when you pile them all on, they have unintended consequences. It's the same with sharing information with the public. It may be crystal clear in a categorical program what it does, but it doesn't always convey from the consumer's perspective. And so I'm committed to working in that space of aging and disability, so that 211 is a great framework, and I think we've benefited from some ARPA, some relief funds to do some enhancements in that, and I look forward to making that actually a better service for the public. And I think I'm gonna hand it over to Marla for the next bit of slides, and then I'm hopeful at the end, if you have questions, that we can help you or answer them or provide more information for you.
Thank you, Madam Chair. For the record, Marla McDade Williams, Deputy Director of Programs for the Department of Health and Human Services. I'm happy to be here as well, so thank you for your time today. I just want to go over briefly some other programs that we operate out of the Director's Office. In addition to overseeing and providing technical assistance to the divisions, we have the Office of Minority Health, which is a small program, about 2 people. They are largely grant supported and work on activities related to health equity and disparities. We have the Patient Protection Commission, which is also relatively new and works on healthcare costs. The Fund for Resilient Nevada, which is, I believe, our newest program, and it's a result of opioid settlement and legislation that resulted from the 2021 legislative session. So they have stood up the office and gotten everything ready. They've done a estate plan and needs assessment, which is available on our website if anybody is interested in that. We have the Governor's Council on Developmental Disabilities. This is an independent agency, and they advocate for persons with disabilities, making recommendations for services and really doing advocacy on behalf of persons who are disabled. We have the Grants Management Unit, and I believe they administer 3 major grant programs. They're responsible for issuing their notices of funding opportunity, assessing the applications, and issuing and monitoring funds that go out. Data analytics, also one of our newest programs. Last session, and Director Whitley mentioned this, but it's stood up to be support for data throughout the department and all the divisions. And then we have the Individuals with Disabilities Education Act, or IDEA Part C, which oversees the system related to children receiving services from early intervention services, so those children 0 to 3 who have extensive needs. As you probably saw in your committee brief, you have jurisdiction over certain titles of the Nevada Revised Statutes. So I just kind of listed out for you some of the key statutes that we administer throughout the department, throughout the 5 divisions and the programs that we have. So that's just a list for you to go over in your spare time, but just to understand kind of where we are if you're looking for the juvenile justice provisions, there's just 2 chapters in Title V that DCFS would have some responsibility over. So, the same, I think, with Division of Aging and Developmental Services, where for abuse, elder abuse statutes, so those are more in the criminal statutes, as opposed to where we have our generalized statutes. Ooh. We also do a lot of work during the interim, as you all do. There are numerous committees, the Joint Interim Standing Committee on Health and Human Services. We spend a lot of time doing work on behalf of that committee and coming before and providing information, similarly to the Committee on Judiciary as it relates to some of the juvenile justice issues for DCFS. And then if you ever looked on your website, there's a whole host of non-legislative committees. And this is just a sample of some of those non-legislative committees. And I believe the reason they're on your website is because they have some legislative representation as members on those committees. And so we spend a lot of time working on legislatures and committees, as well as a whole host of other non-legislative committees that we oversee or that we participate in. I just wanted to highlight quickly some accomplishments that the programs within the director's office have done. Of course, the Office of Analytics, they really have made data more accessible by making dashboards accessible to the public. And we have the list there for you, health profiles by district, and Ms. Morgan can really talk more about all of this if you have a need to really understand kind of what's there and how the data is compiled. But this is really a key use. I know it's very useful for people. The Office of Minority Health and Equity, one of their highlights in the last couple of years was to join the Fountain of Hope in a back-to-school giveaway and really strengthen community engagement and partnerships in that community. The Patient Protection Commission has calculated and analyzed statewide healthcare cost growth and established key components of the healthcare cost benchmark. The Fund for Resilient Nevada, again, we talked briefly about that. They have completed the needs assessment, and that is available on the website. The Governor's Council on Developmental Disabilities has advocated for voting rights for people with disabilities, and they have a list of recommendations. They do have a website that has a lot of information for people related to persons with disabilities. And the Grants Management Unit was able to actually expand eligibility criteria for clients needing rental and utility assistance. They were able to fund additional money to the family resource centers to reduce health disparities and allow for rural communities to improve public areas. Physical infrastructure of public areas. And then finally, IDEA Part C, they have really worked very hard to develop a retention initiative in response to some of the shortages for developmental specialists in early intervention. And we believe that this initiative will really help with the staff shortage and ensure that we can continue to provide those services in a timely and in a quality manner. That really is all I have. As Director Whitley said, we are a very large agency. We have a lot of responsibilities related to children and families, and we all share a goal of closing the socioeconomic and health disparity gap through the programs we administer. I'm happy to answer questions.
Thank you so much for the presentation. I have a couple of committee questions. We'll go ahead and start with Assemblyman Hibbets.
Thank you, Chairwoman. To you and through you to the witness. Thank you. Director, I'd like to take you back to the beginning of your statement. To clarify, did you say that your budget is $16 billion?
The biennial budget, correct. For the record, Richard Whitley. Through you, Madam Chair, to the Assemblyman.
Please feel free to go directly to the Assemblyman. I also want to clarify this. Is that all state funds, or does that include the grant and Medicaid reimbursement dollars you guys?
No, that is just the entire budget in its entirety. It doesn't, with again, I think I mentioned the primary source for this funding is Medicaid, and depending on the populations we're serving, we get a different federal match. It was actually increased during the pandemic, during the federal public health emergency, but it is a match. We have a really nice in our budget presentation that breaks out those costs, which are federal and which are state, which I'm happy to provide.
That would be wonderful if you could forward that to me. I'd appreciate it. Thank you.
Thank you for the question, and I do want to clarify that our committee is policy, not fiscal. So the fiscal stuff is done in Ways and Finance in the Senate, and we here assess policy. So if you have those questions, you're welcome to direct them to policy staff or to the agency themselves if you'd like. We'll stick with policy in this committee. Are there any other questions from the committee? Let's see, Assemblyman Hafen, go ahead.
Thank you, Madam Chair, and thank you, Director and Deputy Director, for the presentation. And Deputy Director Williams, you mentioned the issues that we see in rural Nevada and throughout, and I can't express how much that is, and it's the importance of trying to get additional medical services throughout the state. Could you just briefly, because I know a lot of my colleagues are not familiar with the Certificate of Need process and the importance of that throughout rural Nevada, could you just 30,000 foot explain kind of the importance of that process?
For the record, Richard Whitley, to the Assemblyman. So our office actually oversees that, and so the Certificate of Need, the intent behind it is really to not allow businesses that might actually do harm by coming in and providing an aspect of healthcare to the entire healthcare system. Examples are with specialization that the hospitals in rural Nevada, as you know, are delicate. Most of them are critical access hospitals. Many have a rural health clinic attached to them. They're all dependent. The healthcare workforce shortage that is experienced in the urban areas are experienced even more so in rural Nevada in all aspects of healthcare and specialty. So when a business may want to come into the community and provide, grow something, the intent of that is to look to see will harm occur to the existing healthcare system. We get a couple each year. I'm happy to pull a summary of what we've had. Usually it's a component of healthcare. It might be laboratory or something else, and then we look at in the context of the hospital and the healthcare that currently exists. Also, the skilled nursing facilities that are in the rural areas. One I think in Pahrump there was a request related to a ambulatory surgery center that wanted to provide a service, and looking at how that impacts the hospital. Since my tenure as the director in the past 5 years, I've not denied any of them, and I am confident with our review process for looking at what impacts they have, but it's focused on the rurals, and the intent is to do no harm with expansion of healthcare. There's and Marla, I don't know if you know the dollar amount, but there is a dollar threshold. So it isn't just any aspect, but there is a threshold in that about doing harm. Many states still do this statewide. Nevada does it focused in the rural areas.
Thank you, and thank you, Madam Chair.
Thank you for the question. Assemblyman Nguyen.
Thank you, Madam Chair. Thank you again, Director Whitley, for your presentation. I've had a fortunate to work with you in previous hat in the community, so it's nice to see you in this role now. My question is regarding to one of the topics that you mentioned earlier about mental health. I think doing our training back in December to your Division of Medicaid, I've heard some shortage. Of course, we have mental health shortage provider shortage on mental health and many other specialties, but mental health in particular is my interest. Is there anything that the department and the division is doing in terms of recruitment for provider with language access, in terms of the populations that needing those language access?
For the record, Richard Whitley. We're, as a payer with Medicaid, we are responsible for providing services, all services, including behavioral health, in a language that the consumer can understand. There is a shortage. Behavioral health, actually, we manage the Federal Health Resource Services Administration has a Office of Primary Care that does actual federal designations for workforce shortage areas. It means a lot. It means a lot in our state to know where those shortages are, but it also means federally where the placement of scholarships can go at a federal level for healthcare workers, loan repayment programs, also the J-1 visa foreign physician program, where those physicians, each state gets 16 placements or could get 16 placements, and that workforce shortage means really drives that on where we're eligible. But related to behavioral health, our entire state is a behavioral health workforce shortage area, including the urban areas, particularly in child psychiatry. You'll see in our budget, the governor, one thing that I didn't mention was the enhancements in our budget. This is the largest rate increase that if you were in a budget committee and you looked at the budget, you would see just categorical rate changes. It doesn't really tell the whole story of what we're trying to do. There's several rates that will increase or improve access for children's health, and then primary care. There's some pay parity for advanced nurse practitioners. And in our state, UNR and UNLV, UNR has a psychiatric specialty for APRNs, and UNLV has a pediatric. And so they're really, both those universities are spot on with helping us to meet our state needs. And in some of our neighboring states like Arizona, we saw a real quick increase in access to primary care, keeping people out of hospitals because we're addressing their needs at perhaps at a lower level before it becomes a crisis. I know that wasn't all in your question, but it jiggled my recollection of just how important that is, and I didn't really get to highlight it in our budget because the budget committee's here by budget, and so there's no configuration of how these rate increases really can help primary care, including behavioral health in an outpatient setting, and a focus on children. I mean, with the birth rate of children being 56% births being enrolled in Medicaid, if we can, get women into prenatal care and launch healthy babies and then intervene early, we're gonna help those kids in school when they go to school, as well as launch them into healthy adults, I hope. The workforce shortage is crucial to identify. Add that layer on about cultural competence and language barriers. I mean, it is complex. I would say behavioral health statewide, healthcare in general made more of a challenge in rural frontier Nevada.
Madam Chair, can I do a follow-up? Just one more. I saw earlier a slide talked about Office of Minority Health under the Director's Office. Is this the team, I know it's a small team of two, responsible for some of the language access policy, or that's kind of like a system-wide agencies that all of your departments have someone designated to look at language access?
For the record, Marla McDade Williams, Madam Chair, to you through to Assemblyman Nguyen. So language access was actually legislation enacted in 2021. So we had to do an assessment of all department programs to really look at how successfully we were providing language access and assess our gaps. So we have done that. It's a work in progress. right? But the Office of Minority Health and Equity has been one of our lead agencies in working with our other our other programs throughout the department to help guide that process.
Thank you, Deputy Director. Thank you, Madam Chair.
Thank you for the questions. Assemblyman Gray.
Thank you, Madam Chair. Just a quick clarification. How many employees did you say you guys had?
6,900. I said about 7,000, but yes.
And those are across the state. They're not just isolated in one area, right?
For the record, Richard Whitley, the majority are located in where the population is. Again, our roles are very different. We deliver direct services in rural frontier Nevada. We service the public health agency in many of the rural counties. So we have community health nursing provided out in rural frontier Nevada. And then, as I mentioned earlier, our clinical services, which are mostly facility-based, our hospitals, both with adult and children, are provided. So those take up a majority of the positions, but it really is across the workforce from financing to regulatory to direct services.
Thank you. Assemblywoman Taylor.
Thank you, Madam Chair. And thank you, Director Whitley, and your team for this is a big committee, a big department, and big needs. When I think about, I found myself during the presentation just thinking about the weight of what it is that you carry for all the 3 million plus citizens in our state. I mean, language access, right? Recruiting staff, vacancies, rural versus suburbs, and all of that, and poverty rates and growth, and it seems to go on and on. So it makes me think about what are the 3 priority areas if you that you would have in terms of this is really what we need in HHS that would really help to make a difference? Because you just have a lot. You have a lot. I hope that's not bad, but.
I want to start with just saying that Director Whitley's budget is the second largest budget in the state, or the first, between you and education. And so when we're talking about the issues and services provided by the state, it really is highly focused in your division or your department and your divisions. And so, yeah, 3 highlights is a good start, but there's just lots of areas in which we can dive into. Please go ahead, Director Whitley.
All right. For the record, Richard Whitley. I think workforce is really an area of priority, and it's not just as a state agency, but it's also as the regulator and payer. And I'll just give an example that the agency that I mentioned, Healthcare Quality and Compliance, that licenses and certifies health facilities. In order for, like, if you're a new business in our state, the same workforce that would investigate a complaint or a problem or do a routine inspection are the same. It's the same people that would license a stand-up new facility. So when there's shortages in that area, which it's made up of healthcare workers, nurses primarily, and other allied disciplines who when we delay in that, we delay a new provider because you have to be licensed and certified in order to bill Medicaid and Medicare or commercial insurance. So when we delay, and quite honestly, I intervene in this probably weekly just to help the staff determine the workload. We have to protect the public, but we also need to get access to health care. So that's like a huge challenge, and it's probably my most graphic example. The other, though, is with our hospitals. We have a facility in Las Vegas, Child Haven, which is really an assessment center for kids that have required an intervention from Clark County Social Services for child welfare. And some of those children are waiting placement in a higher level of care. If we have empty units in our children's hospital, but we don't have the staffing. And the one thing that I've held to during the pandemic is we can't admit someone we can't care for safely. And that's really hard to do because you know that where they're at, there's a push to have them in a different level of care, but it's why there is credentialing of standards in facilities, and we certainly wouldn't provide a lower standard. I'm actually really proud that all of our hospitals, children and adult, remain Joint Commission accredited during the pandemic, but the workforce shortage impacts them with their ability to serve as that safety net in the community. Those are so workforce, I think, for the state. We don't pay competitively, and I'm really pleased with some changes that our Division of Human Resources is doing it's not always about pay. Sometimes it's about just how long we take to offer someone a job. And so there have been some immediate changes in that processing that, again, I think well-intended government sometimes piles on, like, a new form or every time something happens, and it doesn't necessarily solve the problem. So I'm hopeful that that our speed at being able to offer people jobs will help us in that service, but we do also have to be competitive. We don't have much flexibility with when we get our budget approved every 2 years for positions to be able to, we go to IFC and we ask if we can move it into contractual, and we're just always slightly behind. And so that is a huge challenge, complicated. I'm most concerned with the regulatory side, because I think it would be a shame if our delays were causing facilities that were trying to stand up and offer more health care were delayed. And so I'm really pleased that Marla returned to state service and has a regulatory background and is helping to take a look at that to see, how we can be more efficient in that area. And, if you're standing up a facility, you have to get local fire marshal, state fire marshal. Then we, in fact, look at it to see if you are adhering to life safety code. And, some of those things just seem like one should count for all if it's a standard and if there's no evidence of failure. So we're looking at all of that to have impact, but it is all driven by workforce. I do think that then in Medicaid, we grew really fast with a system that, with coverage of people, but we didn't really mature the infrastructure that oversees. We prior to the expansion of Medicaid, we primarily were fee-for-service, which is what Medicaid does in rural frontier Nevada, where the patient is made eligible, and then they can find the services amongst all the providers who are enrolled in Medicaid, as opposed to the managed care model that is primarily used in Clark and Washoe County, where we have 4 managed care. So every year we all get to pick a health plan, including the people on Medicaid who have managed care, and they can pick a managed care plan, and they then can use the network that plan has. I think my second area is just really maturing that oversight and leveraging of resources within Medicaid. There are other states have done things. I think you'll hear this session, and it's even in Medicaid's budget, about a provider fee for hospitals, leveraging funding to draw down that federal money so that we can increase rates. So taking a look at some of those areas, we just haven't had in the past the staffing really that has had the opportunity to really focus on some of those policies and creative ways of leveraging federal funding and grow that concurrently with making people eligible. As I said earlier, I think we're efficient at getting people made eligible, but if you qualify and you can't get the health care, it is empty. So that provider side of things, I think is an area. Medicaid needs to make it easier, and we're working on it for providers to enroll. Right now, you have to enroll in Medicaid, then you have to enroll in each managed care. That's exhausting for a provider who's well-intended, who just maybe wants to open their practice up and help see some of the people in the community and share the burden. So that's the other area. I think provider engagement and support, I would say. I think public health would be my final one. As I've mentioned in my overview, it is a service where we're amongst one of the probably the states that invests the least amount of public dollars. So we're mostly reliant on federal funding. I think we held our own with, and Kyra has the data to show that. We actually did very well during the pandemic in some specific areas like our skilled nursing facilities. We had like amongst the lowest death rates in the country. And that was, I mean, if I may, it was an outcome of about 10 years ago. We had an exposure of hepatitis C associated with a surgery center in Las Vegas. And it really transformed our healthcare system in terms of, just the healthcare acquired infections, changed nationally just how healthcare is being looked at. And as a result of that event, we embedded epidemiologists in our health facilities. And I would say that was it's one thing that I think made us ready to look at infection control practices in facilities. And this was, absent having a vaccine available, let alone did everybody, choose to get one. The practice of infection control, we had made that change as a result of a past tragic event where we changed our systems. But I think, of course, lost my point in that. You asked for three areas, and I did lose my point. It was such a good story that it just popped in my head, and but I think it just highlights that sometimes we have events. We deliver public service with humans, and we make mistakes. And I'll be the first to tell you, when I make a mistake, I own it. I want to learn from it, and I want to improve it, and leave the system in a better place. So when the event occurs again, public health, that was my third thing. Public health, I think, doesn't get really a lot of attention until it's needed. And then the intervention is if it's a disease outbreak, and it's contagious and it's respiratory. We've had drug-resistant TB. We've had other diseases. The pandemic is probably what people are most familiar with, and then the limitations that were imposed, but that's not all of public health. I mean, public health, when it's often working the best, you don't even know it because your community's protected. Those determinants of health, like, the biggest drivers in health are nutrition, physical activity, and tobacco use. Those are all behavior-based really that or can be influenced by behavior. So public health has a lot of initiatives in that. We have cobbled together to the best of our abilities the pass-through of funding, but we don't have local health districts across our state. I'm really excited with the leadership from Churchill County with growing a health district. So then we will fund them as a district like Clark and Washoe. We do some delegated authority to Carson City, who's partnered with Douglas and Lyon in some aspects, but they haven't moved to formally become a health district. To become a health district then gives you some entitlement to some federal funding to come through. So there are benefits there. So growing and maturing that, I think, is my third area, and just lessons learned from the pandemic.
Thank you very much. I'm not sure that was three, but we'll go with that. Thank you, Madam Chair.
Well, I tried to warn you. I tried to warn you.
You did.
And as the farther you dig, the more you see how much work there is that can still be done. And it feels endless because people change and their needs change and our communities change and grow and become more diverse. And so it is an endless call to action and a duty to take care of our communities. I have one more question before I have a couple of comments that I'd like to make. but thank you for outlining some of those issues. And as you know, committee, as we said at the beginning, these are the experts. And if you have questions in these areas, I've never had a problem with reaching out and asking. So you can always ask staff for their contact information. But these are the folks who know what's going on the ground and are helping. Oh, I did want to say, to your point on public health, your offices are also kind of the initiation point for places having environmental inspections, right? So your food comes out clean. So the bathrooms are clean in facilities, community facilities. So that facilities are operating at a high standard, or at least a consistent standard. All of those things, which when we walk into a facility, we often take for granted or don't notice, they start in your office. And those regulations are developed in your office. And the people who regulate those standards and ensure those facilities are meeting those standards, they start in your office. And I think sometimes it's easy to overlook that as being really like a foundational baseline of what we take for granted as being the standard of operation in our communities. But those all start with the work you guys do, and weren't stood up by accident. It was definitely because we need to make sure that facilities meet a specific standard so that the community is taken care of. Okay, Assemblywoman Gonzalez.
Thank you so much, Madam Chair. Cecilia Gonzalez, Assembly District 16 for the record. I was just wanting to follow up on Assemblyman Wynn's question about the language access. So you said you were working with organizations to figure out gaps, and I'm just curious, have you identified these gaps? What are the gaps? How are we providing solutions for the gaps? And then my other comment is I am on the district health profiles, and wow, this is so much data. And so I think this is great. It's accessible. And I hope, well, I will have many more questions after I get more time with this dashboard, but thank you so much.
Madam Chair, for the record, Marla McDade Williams to you, to Assemblywoman Gonzalez.
You can go straight to the member.
So what we did in our assessment is we actually, they're internal assessments, so they're not outside of our department. So we do have individual reports of where we identified some gaps and what the needs are moving forward. And I'm happy to share that link.
Thank you. That would be great if we could follow up and share that with the committee. I think that's important information. And to that point, the data transparency undertaking of your office has really been, I think, one of the greatest moves our state has made towards just including the public in where we stand as a state. So it's not a surprise when we hear on the news that we're 51st in the nation, that we're seeing why. It's kind of the story told by that data. Just really appreciate your effort there. Thank you so much for that. Are there any other questions from the committee before we let these fine people go? Well, thank you so much for being here today. We really appreciate you taking the time to introduce your offices to us and let us know what you're doing and what we'll look forward to this session. I know we'll see you more as we move forward, but appreciate you being here today. That gets us to the last part of our agenda today, which is public comment. We ask that public comment be kept to 2 minutes in committee. Please avoid repetition of comments made by previous speakers. We do this to ensure that everyone gets an opportunity and that there's equitable access to the public comment period. If you would like to follow up, you are welcome to submit comments in writing, and those will be distributed to the members as well as included as exhibits. Staff will be timing each speaker during public comment. Please clearly state and spell your name for the record, and then we will start your time. We will begin with public comment from those in the physical locations and then move to comments from anybody who may be calling in. Is there anyone in Carson City who would like to provide public comment at this time? Seeing no one. Is there anyone in Las Vegas who would like to provide public comment at this time? I don't see anyone coming up to the tables. BPS, would you please add the first caller on public comment to the meeting?
Chair, the public line is open and working. However, there are no callers at this time.
Thank you so much. I will then close public comment for the meeting today. Before we adjourn, are there any comments from the membership for this morning or this afternoon? Well, I appreciate you all being here today, and I know that was a brief overview of some of the work we will be undertaking this session. I also wanted to make note that if you want to follow all of the issues in healthcare, they don't only come to our committee. A lot of the licensing, certification, and job growth issues will go to Commerce and Labor Education. So keep an eye out on those committees as well for some of the bills that may not make it to our committee but are pertinent to this area if you're interested. That concludes our meeting for today. Our next meeting will be on Friday, February 10th at 1:30 p.m. And with that, our meeting is adjourned.